Okay, well, hello everyone. Thank you for joining us today for our March eLearn call. Our topic for today is e2AETC, Expediting Core Immediate Post-Survey Response Rates, which is a platform currently in development with RDE Systems and the Northeast Caribbean AETC. And we'll hear more about the evolution of this project during the call. Our presenters are Jesse Thomas, Project Director of RDE Systems, and Dr. Daria Boccher-Lattimore, Director and co-PI of the Northeast Caribbean AETC. My name is Judy Collins. I am your facilitator for this call. Before we begin, a few housekeeping tips. Just please remember to, if you mute your computer speakers, if you've dialed in, please do not place us on hold so that we can avoid hearing your hold music. This call is being recorded, so the slides and the recording will be available on our website after the call. Please do enter your questions into our chat room, but we will try our best to reserve questions for the end of the call, and our presenters will kind of respond as needed throughout. So before we get started, I just want to give you a little heads up. Oops, sorry. Move my slide over a little bit. The purpose of today's call is to learn about this new platform and to understand the rationale for it. This will be an interactive session, so during the call, participants will be asked to list some of the challenges with collecting PEPs or IP surveys, which then helps to understand the approach for the development of this platform and the use of mobile interactivity to address some of the challenges with collecting the surveys. And then we'll learn something more about the platform's dashboards and features that will help to improve IP survey response rates and evaluation efforts. Our speakers again are Jesse Thomas and Dr. Daria. Many of you already know Jesse. He is no stranger to the HRSA and Ryan White HIV/AIDS programs. Over 20 years, he has provided TA services in the public health sphere, with over 15 years in the field of HIV, serving as the technical director of several HRSA and Ryan White projects, and also for academic medical institutions and community based organizations, throughout the country. He and his team at RDE Systems create data systems and user-friendly tools for providers, consumers, and grantees to improve processes and impact clinical care outcomes for people living with HIV. And he strives to make these tools understandable and fun. And I'm sure most of you know Dr. Daria, who is what just happened? Did you guys see this?
Yes.
My screen just did something very strange. I'm sorry. I don't know what's happening. Let's see. Oh, thank you. Did you do something, Liz?
I hit restore. I don't know why that did it in the first place.
Okay.
Continue.
Sorry. My apologies, everyone. Okay, so Daria, there we are. She is the assistant professor of clinical socio-medical sciences and psychiatry at the Columbia University College of Physicians and Surgeons, and the director and co-PI of the Northeast Caribbean AETC, as well as the president of the National Alliance of HIV Education and Workforce Development, or NAHUD. She is an HIV care veteran with over 30 years experience in behavioral health and community-oriented primary care in various settings. She's skilled in assessing programmatic need, implementing evidence-informed interventions, program evaluation, grants management, and continuing education, and she has been a member of the AETC community since 2005. Thank you both for presenting on the call today. Jesse will lead the call, and Daria will chime in and respond to questions, particularly as they relate to AETC programmatic work. And I will now turn it over to you, Jesse.
Thank you, Judy. Welcome, everyone. Good afternoon. So just a little bit about us that might be relevant to today. A lot of what we've done has been based around web-based and mobile development for a while. I'm a computer nerd, for those of you who don't know me. I grew up, building computers and connecting on worldwide networks. And I fell in love with public health about 20 years ago. I've been at RDE Systems now for over 22 years. And we've done some pretty neat things. We built the first consumer or patient client satisfaction survey in use in Ryan White across the country that was web-based, mobile, and Akasi. We also have done some provider surveys and comprehensive needs assessment surveys. So a lot of direct access with patients, including a low health literacy patient portal. Actually also at Columbia NYP with Dr. Peter Gordon, and it's been replicated in the Bergen-Passaic TGA. And so I fell in love with the HIV field about 15 years ago, where this is not just a 9-to-5 job for folks. This is a mission-driven group of individuals, and that's what we love doing. We love building systems that help make a difference. I love the idea of using data and technology to help end the epidemic, and that we've been very transparent about how we do things. We had this thing called process over product methodology, which is trying to look at the human and user-centered views of technology, so that really, the human component is the #1 component in all these technology projects. And I think I see a lot of that sort of missing in other fields where IT is kind of run by IT people. So I think you'll see some of that built into today. And I think we're going to show some pretty interesting things. If you've got your mobile phones, have them ready, because you're going to use them for this little interactive thing that we're going to show you. And some of the work, we've done a lot of HIV work from around the country, and some of this is kind of inspired what we're doing today. And I don't know if, Daria, if you want to talk about how we came to be talking today.
Sure. So I was fortunate enough to meet Jesse about a year ago now. So it came out of our work in Puerto Rico as a Northeast Caribbean AETC. They were having challenges with health information exchange, just in general, sharing information between the federally qualified health centers and their Department of Health funded HIV centers. And that became a part of their integrated care plan. And then the hurricanes happened, and that really highlighted the challenge, even within their own systems, of being able to share and follow patients and make sure they're on their meds. So as an AETC, we partnered with the Part A and B in Puerto Rico and did some, developed what we're calling our HIE initiative, our Health Information Exchange Initiative. And with our evaluator, Mary Millery, we did some key informant surveys of clinical providers and of the leadership in Puerto Rico, which all culminated in this huge summit about HIE in Puerto Rico. And we invited experts from around the country to come there, and one of which was Jesse, to share his experience in this field and how to make things work, as well as we had folks from who worked in Louisiana after Hurricane Katrina. So it was a very successful symposium to bring together disparate groups that usually didn't share information, and we're building on that initiative.
Yes, and then Daria was talking about some of the AETC sort of data systems and sort of challenges around, the collecting the immediate post surveys and using that data to make a difference. So we were brainstorming, and I think we came up with something kind of interesting. So let me start this interactive piece. If you all have your cell phones, I'm going to ask John Felix, who's with me, to help do this interactive little poll, and you'll see how that ties in a little bit later. Let me just stop sharing. So you'll see on the screen, if you can see, there's this QR code. There's also a website here, e2polls.com. If you have an iPhone, your camera, if you just point your camera at the QR code, it'll direct you to a website. You just go there. If you have an Android, there might be a QR reader. Some of the Androids do have the QR reader built into the camera. And you can just sort of, point it at the screen, or go to e2polls.com and put the access code in AETC. And on the left-hand side, you'll see John Felix go there. It'll actually prompt you for your email address, and this is the PIF ID once it logs in. Okay, and so you'll see here, please enter your email address or PIF ID. So later on, we're going to sort of simulate what this would be like for training participants in the middle of the training, at the beginning of the training, at the end of the training. Presenters can use this to do icebreakers, find out what participants hope to gain from the meeting, who's in the audience, make it sort of interactive in the beginning, and then the system will keep you logged in, keep those mobile devices logged in, so that at the end you can collect a PIF, or I'm sorry, the immediate post survey. So we can go ahead, and I see there's 19 folks have joined. So Jean-Felix, you can advance the slide. And let's just do a little survey together. This is, which region do you represent? Go ahead and select, and you'll see. The results in real time. Great. And on the bottom left, just for those of you who are looking, it says participants 16 out of 20. So we can see how many people responded versus how many people are logged in. Great. So Midwest is winning with 5, and then we've got New England, NCRC at 3, and then Southeast at 2. Looks like the only representation we don't have is South Central, Mountain West, and the NCCC. Great. All right, let's go to the next one. And at any point, if you just, someone walked in late, you can always go to e2polls.com and put the AETC code in. That's always displayed on the top of the screen. And for those of you who are not using your phones, Jean-Felix is showing what it looks like here. The next question is, what is your current roles? Great. So we've got administration, IT, data, coordinators, one coach, dissemination, and some others. All right. We'll go to the next one. In your region, what percentage of IP surveys are filled out on paper? We know that there's some mixed methods. There might be some incarceration populations that you can't reach with technology. So I don't think we'll ever get rid of paper. More than 75%. That seems to be the winner. And then the next up is less than 25%. All right. We can go to the next one, John. Now this one is a yes or no one. Are you personally involved with the distribution, collection, transcribing, reporting, or using these IP surveys? You guys are fast. All right, we've got 15 yeses and 5 no's. All right, go to the next one. What are your top 3 challenges or aspirations with IP surveys? Reaching IP survey response rate targets can be improved. IP survey distribution and collection is time consuming. Transcribing paper forms can be error prone and time consuming. If participants do not complete IP surveys before they leave, follow-up can be challenging. We call that the chase. We wish we could provide immediate feedback to our trainers and coordinators for continuous quality improvement, and I would like to make my evaluations more engaging. Just pick your top 3. All right, so let's do the top 3 we have here. We've got a tie for reaching response rates and chasing folks afterwards. And then next up, we've got distribution and collection is time consuming, and then be more engaging. Great. All right. And then this is open-ended. You can, if you didn't see something here, one of the selects, you can just answer open-ended. It's anonymous. What other challenges do you have around data collection, processing, reporting and using IP survey data. Bottom left, I can see when people are typing. Analyzing results, lack of flexibility in survey questions, matching tips for registration and evaluation, nothing significant. Hard to know that the data are valid if persons feel they're overburdened with surveys and just complete them to not be reminded any further. The chase, cleaning data, surveys are too long. Paper IPs are 3 pages long, and for big programs it's a pain to disassemble the paperwork to scan our regional to our regional evaluation team. Survey length, participants quickly completing, not truly reading the questions and responding. Participants see little value in taking the LT survey. Not sure what LT stands for, but maybe someone can educate me. Matching PIFs to PEFs, and the PEFs I understand are also called IPs or immediate posts. Convincing attendees of their value, survey burden. Some people submit more than one. The JSI survey is too long. Okay. Local partner. Repetitive survey. Yes. Okay. Oh, we got some more people. Local partners, yes. Each individual state ATC. Okay. Okay, now we can jump back to the PowerPoint. That was great. I hope you enjoyed that. I don't know if you've used that before. It's actually part of a free tool that we have for those who serve the HIV community. It's called e2Polls, and the HIV program side of it's called e2Polls Red. So let's go back to great. So some of the challenges, exactly what you all reported, is what Daria and Mary and I were talking about, which is that this evaluation data is critical for compliance. You know, you have to report this. It's also important to tell the story. You know, this is federal dollars that are being used, so we understand that importance. And also for continuous improvement, that you want to use the data to improve things. The immediate post-survey response rate can be improved. The IP survey distribution and collection can be time-consuming. Transcribing from paper is error-prone and a burden on staff, you know, because paper has no validations. It can't match up the PIF IDs if someone makes a mistake. And then we've got transcribing that from paper is error-prone and a burden on staff. Paper is not the best for emerging e-learning technologies and that sort of experience. Following up after training consumes time. That's the chase. And people may mean well, but they're forgetful and busy and got other things to do. And even the electronic methods suffer from losses in responses and that delay in the recall of the event, you know, if they're answering it a couple days later through an email survey or something. And also that time gap between the event and getting that evaluation data, so you can give that information back to trainers and coordinators to you know, give them some immediate feedback on how it went. And the Northeast Caribbean AETC wants to get more complete, better data, faster to deliver value for continuous quality improvement. Those are some of both the problems and the opportunities. So we had some guiding principles and inspirations from adult learning theory, using actionable data visualization. So it's not just, it's something that's digestible, something that you can interpret and analyze quickly, and embed some practice transformation concepts into this. using data for CQI, and taking this, compliance requirement and turning it into potentially a tool for excellence. And so the vision was, let's improve the training experience for everybody, simultaneously improving the IP data collection and entry in real time, maximize the response rates, and minimize the human error and time spent on these paper or half electronic processes, increase the speed of training evaluation feedback cycle so trainers get that feedback right away, deliver actionable feedback and value almost immediately to the stakeholders involved, take that CQI mindset with the IP data and transform that compliance requirement into a tool for excellence and maximize the value of this evaluation data. So we're going to come up with this idea through leveraging existing resources, and that was this e2Polls real-time audience engagement tool that you just participated in. And that was originally developed internally by us at RDE for our own stakeholder engagement. We wanted to engage users before a launch, after a launch, get users engaged in the development of their system, the documentation of their needs, and as they emerge over time. And also for trainings. We did this for pre and post trainings that we did, so we got to see how our trainings were and what folks were thinking, not just in terms of their knowledge, but their confidence and optimism with our system launches. And just for interactive engagement, make things more interactive and engaging to keep people's attention and have them be a part of the process and help retain the information a little bit better. And so we launched E2Polls Red on World AIDS Day. So that's now offered available for free. If anybody wants to use it, just go to rde.org/red. Or you can say yes at the end and we'll send you an invitation. The Northeast Caribbean AETC was an early adopter. They saw this being used at my Puerto Rico talk for the Health Information Exchange Symposium, and they adopted, I think Marianne is on the call today, and they've been using it really, really great for there. So well, how can we use this as an integrated component of getting that IP survey response rate? And so we're building a platform called e2AETC. And so the broader context is that, in terms of registration, in terms of delivering of the trainings, being able to have all that data integrated in one place, and so that we can link the PIF IDs to the ERs, to the trainings, and then to the immediate post surveys. And that's why at the beginning of the E2Polls survey that you all took, it asked for your PIF ID, which we know coming up soon will now be moving to an email address, which I think should make things a lot easier. And so what you're going to see is part of a broader context. There's a lot more that's a part of what you're going to see today, but this is just a small component of that will be integrated. And the key innovation, what we thought of was, if people are, going to fill out a survey, traditionally it's been on paper or a colored paper or sent as an email link, and trying to get people to do that is challenging. But if we can engage them in a group interactive activity before they end, then we can just transition to a private survey, the private immediate post version of this, right at the very end of a group interactive activity. So now that we've got their attention, they're all on their devices, they're doing something stimulating, then just boom, switch over to getting the immediate post. So that's what we call E2Polls Hybrid. And I'm going to switch this over to Jean-Felix, and we can better to just show it to you how it works.
Are we frozen?
Sorry guys, I pressed the wrong button on my phone. So this is going to be a simulation where this is pretend that we had just finished a training. We're the trainers at one of these trainings, and we're going to do a group activity. So if you go back to your phone, if we, John Felix, if you advance to the next one. Great. So pretend this is a group activity that the trainer or facilitator is going to do at the end of a session. Hello, training participant. What top things have you learned today that you find of practical value that you can start applying? So this is something that you can just type in. We don't have to fill it out as much. I wanted to show you what the transition looks like. So free software. Nothing yet. Good, good. Okay. All right. When to recommend to prep. Very cool. All right, we can go to the next one.
I think we have a straddler.
Yeah, by the way, one of the neat features is that little blue icon on the bottom left lets the presenter know that someone's still typing on their phone. Okay.
There you go.
What topics would you like to learn more about in the future? Again, if this were a group activity, these were some good questions suggested by Daria. You. Hi. Cultural competency, great. Okay, so then let's switch over to what the IP survey would look like. So again, pretend you're sitting in the audience and you're doing this group activity, and then when John Felix clicks on the stop, it'll immediately transition to, if you look on your mobile phones, it'll say, welcome to the immediate post survey. From this point, your responses will remain confidential and will not be shared on the presentation screen. Answers you submit will be synced to your participant record. So this is the innovation here. This is where you can go ahead and start filling this out in your own pace. See, the group activity we did, all the E2 poll stuff up until this point has been synchronous. We've all been doing this together. Now this you do at your own pace, and our participants can then go through this is the IP survey that we have. So Jean Felix will just kind of go through this. You're familiar with these questions. At the end of this, we've set this up so that the Northeast Caribbean AETC can add their own local customizable questions so that by training event, by site, they can collect their own information tailored, and that would include both everything. So all these questions should look familiar to you. So within 60 seconds or 2 minutes, you've just gotten your IP survey data that you can then report on. And Jean Felix can show you what that looks like. And at the very end, there's a message from the presenter and all of that. So this is E2 polls, and he's going to go to reports. And this is still like a sort of a prototype version of this, so we don't have all the features just yet. But the idea is that your information is reportable immediately, and you could deliver this data to your trainers, your coordinator, pretty much in real time, right after. And so you have aggregate data here, and this is your immediate post-evaluation surveys. And so all this is charted for you. You can export this to PDF or Excel. You have real-time access to your data. So these are all the answers that was collected just in this short period of time. We know we didn't give everybody a lot of time to fill this out, but I just wanted to give you a little simulation of what it looks like. So you've got all the data here. And if you have multiple events, the system will automatically aggregate that if you'd like. You can deaggregate, you can aggregate, so you can see your survey results over multiple sessions, and we're building in, filters and stuff for professions, trainers. So this way everything is all linked together. All right. Anything else, Jean-Felix, did we want to show on the reporting side?
There was a question about what if participants don't stay to complete the survey, and can you follow up with them?
Good question, Brian. That's a perfect segue. Let's go back to the PowerPoint. All right.
There we go.
So the next topic is the dashboard. We wanted to build a really user-friendly dashboard to give quick information to coordinators, administrators, central offices, also available directly by coordinators. And we wanted to find out, am I reaching my IP response rate targets? How can I easily follow up with participants who did not complete their IPs? So that's Brian's question. Which professions are we reaching? What are our trends? And how can I easily deliver actionable, valuable real-time data to my stakeholders? So this is a prototype dashboard that we have here. And you can see up top, this is the e2AETC dashboard. And we can look at different time frames. We can look at different levels of training, look at different disciplines, the upcoming event, the most upcoming event, RSVPs before with a little ticker of how we're looking in terms of RSVPs, on our current IP response rate. This is for the most recent one. And then we can just click that follow-up button. And because we have the email addresses, either from the IP evaluation that people put in at the very beginning of the training, or from their PIF and their registration with the event record. So that's all integrated. So with one button, they can look, and if they didn't get a good response rate for whatever reason, just press the follow-up button, and it would send out a blast email asking them to finish, please. So that's, I think, Brian's question. And then we have here, and I think Jean-Felix just put into the chat thing here that this link would be generated and, can go right to it at any point. And then you've got like a little visualization here, your events completed, look at your targets, color-coded, the total participants, and then your IP survey completion rates over time. Also, before I move on, there's going to be some other things too, evaluations. We're also building a SPINS evidence-informed intervention tracker. We know that that's a new requirement, and I think there's some interesting things that can be done there too. And then down below, if you scroll down on the dashboard, you can look at average event goals with completion rates, participants per event. We're refining the indicators, but the idea is that you can get a sense really quickly, color-coded, how things are going. And then these are all the event histories with the post surveys here listed with these little color-coded bars, and then a link to each one, resend post survey. So this is that tool that can do those little blast emails automatically for you. And then I've got a question here. It says, remind me, how does the system know who to send the follow-up to? I believe that's worked on the registration. So if you register for an event, but you don't complete the survey, and then the AETC will be marking attendance of who attended. So in one system, they can mark attendance, and then the system knows from the PIF ID or the email address who completed their survey and who didn't. So then it's got that, list of all the people, all the email addresses who did not complete. And then so it would just get sent out to those, which is an important thing. We don't want to sort of spam people who already completed their survey interactively really quick. We don't want to spam those folks with saying, please complete the survey. The JSI survey, I don't know, we could speak about that one separately. I think that might be a different one. And then, yes, does this link into a registration system or have its own feature? Yeah, we're building this from the ground up for the Northeast Caribbean AETC, so it's one integrated system. But we're thinking of having this E2Polls hybrid, this post-survey tool, have an API or an import-export function for other systems if you're not using this big integrated system called e2AETC. So I think for the Northeast Caribbean AETC, their opportunity for impact annually is pretty significant. we can improve that experience for about 14,000 participants across 9,400 immediate post-evaluation forms, across 1,400 training events with 100-plus trainers, 11 regional coordinators, and one director who's got to make all this work. I think that's what we're aiming for, is a positive impact in all these areas. So some final thoughts. I think this was something that we try to have a novel approach of technology and the human experience, and try to get that group interactive experience linked up with collecting the final, the immediate post surveys, and then provide actionable visual dashboards for any stragglers who didn't fill it out right there, who had to leave early, say. And I think that's it. Anything else, Daria, you want to add?
Sure. Yeah, the other thing I wanted to say, I think the strong points about it are, optimizing the moment so that when we have folks in, this becomes part of the training. It's not seen as something, separate. So if we can sneak that final survey into them at the same time, that works. And we were also just brainstorming about, how can we best utilize this data? It's not just for the evaluation. It's just not to submit to HRSA. It's really to provide feedback to our local partners or regional partners. They can provide feedback to their trainers. And thinking about integrating this in a way where we can learn more about the data by profession or the data by type of training. So I think it was just, we felt like we were losing an opportunity to use the data that we're required to gather, and how can we best use it. So this is our brainstorming about that.
Well, thank you, everyone. I think we can open it up to questions. If anybody has any questions or comments, just curious what you think.
Yeah, I don't know if you see that there's another question from Brian in the chat room, and he wants to know how you handle submitting the data to HRSA.
So I think the way it will work is that there'll be an export that will go, that Daria can run, that can get sent to HRSA. Is that right, Daria? That's what the version believes?
Yes. Yes.
Okay. Yeah, the key thing is you'll have access to your data real time. That's the most important thing. Whenever you need your data, you can export it to Excel or HRSA format, whatever you need.
Another question from Vanessa, will the core LT be added? Well, LT is long-term follow-up. The core LT be added.
Jesse, that's something multiple weeks or months after a training that we follow up with the same provider. So we haven't talked about that yet.
Okay.
We follow up with some participants, several days beyond the training with another service.
So the way, all right, so it could sort of trigger like, hey, an LT needs to get sent out, click here to send out the LT and track the response rate, I'm guessing, right? Something like that.
Yes.
And Happy wants to know, has engaging learners in polls during training increased evaluation response rates? Have you seen, is there data on that?
What you saw today hasn't been launched yet, but the E2 polls has been used separate from the IP survey process. I don't know, Daria, if there's any data on that or qualitative or anecdotal information on that.
That's a good question. No, we haven't, since we haven't launched this particular module, we're not sure. But we know that using the interactive polling during the training has increased interactivity. So I guess we're basing it on that assumption.
I think it was because you're using the same technology for both engagement and evaluation. Any other questions?
Yeah, Brian, I think so too. Yeah, I think that's right, because I like the terminology that Daria used, optimizing the moment, because it's all right there. I think it should increase the response rate.
Any other questions? Matt's typing. So can you, while we're waiting, can you share some next steps? What can we look forward to? I know it hasn't been launched yet, but Is there anything you can share about what we can look forward to, perhaps in, fingers crossed, the next grant cycle?
Yes. Yeah, we're hoping that this will all be ready by July 1. We're hard at work. I think doing some really interesting work in some of the other areas. Like I said, this is just one area of the AETC business processes and interactions with trainers and participants and the admin side. So I think there's a lot of interesting work being designed right now.
And I think we'll have some pilot data too by that time too.
Right, right. Okay. Well, let's see. Oh, any more questions? Matt is saying, I don't think it would increase the response rate over paper. We get the forms as they leave. How would you address that?
Well, I think paper will always be with us. You know, there's incarcerated populations. There might be other scenarios where you need paper. But, you know, paper, you've got to then transcribe it or scan it and validate it and then merge it with the data, you know, your data set. So I think the idea is reducing, not eliminating paper as much as possible. Anytime someone touches paper, it's an opportunity for a typo or so I think paper has its place, but I think the idea is, you know, looking at minimizing paper as much as possible.
There's always also that population that will never let go of using paper, and I am one of those people who still uses a pen and paper and writes things down as opposed to entering it into my phone. So you'll have a few of those as well. Will the systems you're building? Sorry, go ahead.
I was just going to add that we're sort of tapping back into adult learning principles, right? Everybody learns differently and everybody has different things, so there's never going to be one answer for everybody. So we want to make sure we engage the variety of our learners, not only in our education, but also in engaging them in our evaluation. So.
Right, absolutely. And so Salva wants to know, will the system you're building be accessible for other AETCs? I think you did answer that, but go ahead and review that for.
Yeah, like our other E2 systems around the country, we'll make it available if folks are interested in it. And you know, if anybody's interested, we can share a little bit more where the vision is, where it's going, so you can hit the ground running for the next grant cycle and some future date if you like.
Here's a really good question. How much data does E2 polls eat up on your phone?
Good question. You know, I don't know if John Felix has any actual data, but I think you can see on the screen that it's very lightweight. You know, there's not a lot of graphics. It's just mostly text. So much less than the average website, I would say. And we can actually get data on that.
That would be good to share. Yeah.
Yeah. And hopefully most of these places have like Wi-Fi or whatever, but we know that not all places do. But yeah, it's very lightweight. We designed it lightweight, not just for the data usage, but for the responsiveness. I think you can see it's pretty fast when you click next as a presenter, like it instantly changes on your phone. So that's really the other reason why we designed it to be so lightweight.
Let's see. I think someone else has touched. We are running low on time. I know everyone has other obligations. So I think I don't see anything coming in at the moment. So well, on the screen here we have Jesse and Daria's contact information. Of course, if you want more information, feel free to reach out to them directly. And I'm sure we'll be hearing more about this platform in the next coming months, so stay tuned. Thank you both for presenting on the call today. It was very informative, and I'm sure everyone is eagerly waiting to hear more. Just wanted to give everyone a heads up for the next eLearn call, which is in June. We'll share more information as topics come available for that. If you do have any suggestions, of course, contact me. I want to say thank you again to our presenters and to everyone joining the call today. I think we will conclude.
Thanks, everyone. Thank you, Judy.
Thank you so much.
Have a great day.
You too.
Bye.
Bye.